It is a great satisfaction to greet you again. I hope you and your pet are well. Today we will talk about the following. Why does my dog urinate a lot? The first thing to rule out is a medical condition. Many health problems can cause increased urination, and only a vet can help you get to the bottom of the problem. There are also many other factors and causes for dogs urinating more than usual, aside from medical conditions. Very frequent urination with large amounts of urine is known as polyuria. This is a different condition than frequently urinating small amounts, known as frequency. These are the causes. 1. Kidney failure or infections. Kidney failure occurs when the kidney cannot effectively filter waste products and toxins from the blood. These toxins carry water with them, causing increased urination, usually in large amounts. 2. Diabetes mellitus. Diabetes is a disease in which the pancreas does not produce enough insulin, or the body stops responding to the insulin produced, causing the level of sugar, glucose, in the blood to rise. The body tries to eliminate this excess sugar through urine. This glucose drags water with it, causing increased urination and thirst. 3. Diabetes insipidus. This type of diabetes is rare in dogs. Although it shares the same symptoms of excessive thirst and urination as diabetes mellitus, the two are different. With diabetes insipidus, a dog is unable to react to or produce a specific antidiuretic hormone. 4. Cushing's disease. Cushing's disease is caused by the overproduction of cortisol, stress hormone, and steroids by the adrenal glands. This causes increased thirst and urination. Other clinical signs include tummying, panting, thin skin, hair loss, and increased hunger. 5. Hyperthyroidism. This condition is rarely seen in dogs and is most often caused by a cancerous mass in the thyroid. Some other symptoms of hyperthyroidism include vomiting, constipation, hyperactivity, and weight loss, but being very hungry. 6. Pyometra. This life-threatening condition is an infection of the uterus in female dogs that have not been spayed. Bacterial toxins released into the blood affect the kidney's ability to hold urine, causing increased urination. Dogs often drink more water to make up for the increased urination. 7. Hypercalcemia. With this condition, dogs have abnormally high blood calcium levels, and you may see poor appetite, vomiting, constipation, lethargy, depression, and confusion. 8. Cancer. Certain types of cancers, especially those that affect the urinary tract, such as transitional cell carcinoma, or those that raise calcium in the bloodstream, such as lymphoma or anal gland adenocarcinoma, can cause increased urine production. 9. Infection of the liver. Bacterial infection of the liver, specifically and more commonly with leptospirosis, leads to increased urine output and increased thirst, usually after the bacteria infects both the liver and kidneys. This infection is deadly if left untreated. 10. Electrolyte imbalances. Sodium or salt imbalances cause increased thirst and urination in dogs. Sodium attracts water. Also, the kidneys will not retain or store water properly if there is an imbalance of sodium and potassium in the water. Dehydration, foods high in sodium, certain toxins, and other medical conditions can cause electrolyte problems. 11. Side effect of the medication. Certain medications can cause increased thirst and urination as side effects. 12. Psychogenic polydipsia, increased thirst. This is a condition where your dog takes in more water than necessary and therefore needs to urinate more frequently. This diagnosis requires ruling out all other possible medical conditions. It is believed to have a behavioral cause. 13. Bladder infections. Bacterial infections in the bladder cause increased urination. This can manifest as urinating large amounts of urine or straining to urinate but only passing small quarter-sized puddles of urine. These infections can also cause blood in the urine, tinted pink or red. 14. Stones or crystals. Crystals or stones in the bladder, often composed of struvite or calcium oxalate, cause irritation to the bladder or the lining of the urethra. This inflammation causes the dog to feel an urge to urinate and often leads to frequent urination of only a small amount of urine and straining to urinate with or without blood. 15. Prostate problems, enlargement, cancer, infections. Infection or inflammation of the prostate can cause changes in urination, including increased amount of urine, increased frequency, straining to urinate, and sometimes blood or pus in the urine. It is a pleasure to inform you and help you. If you have not subscribed to the channel, you should do it now. Take care of yourself and your furry friend. A hug, and until the next video.